Many of you may have an idea of what economic development is. I do. It's about job creation. It's about maximizing wealth. It's about creating wealth, creating opportunity. But I'm going to talk about a different way to approach economic development, and that is making healthcare an economic driver. And Mississippi does a great job. This area does a great job at going after projects, going after the big auto manufacturer or the big steel company or the big widget maker. But I submit to you that we can treat the healthcare industry similar to the way we treat industrial economic development projects. How did this all start? How do we begin to think about this? A little bit of the history. A business delegation was led by elected officials and business folk from the Jackson area, and they took a trip to Houston, Texas. Now, Houston is where the Texas Medical Center is. And a little bit about the Texas Medical Center. It represents about over 100,000 jobs, $10 billion in local economic impact. 20,000 of those jobs are held by scientists, researchers, and physicians. But it's a behemoth, and its tentacles spread wide and far, and it touches everything. The Texas Medical Center has its own bus system, its own hotels, the residential impact of it. They all coincide to develop and maintain a sense of place and purpose. But this new way of targeting economic development transpired when those folk went to Houston, to the Texas Medical Center, and they came back with a renewed sense of vision and purpose. And they got to work, and that's why we're here today, to talk about creative ideas and new ways to approach something that may be old, but take it, slice it up, and make it something new. But why healthcare? Why is it that we would focus on an industry like this? And why not continue down the same track or the same path? Well, yeah, it's a complicated industry. It's a multi-billion-dollar industry, but it's one of the fastest growing industries in the world. 10 of the 20 top jobs, fastest growing jobs, are in the healthcare industry. By 2018, the U.S. will have created over 6 million additional healthcare jobs. So why go after an industry like this? Why go after a complex, highly regulated, an industry where hospitals are subsidized by government, an industry that has more and more laws that have sometimes ramifications if we violate those laws? Why go after a complicated industry like this? Because it's growing, and it's where we are. It's where the future is, and it's where our technological advancements are going. From commercialization of the research that's being done, by growing research programs, by the clinic programs that are being done, or telemedicine through, if it's the widgets, then many medical devices, the medical device manufacturers, the pharmaceutical companies, it's a broad and comprehensive, complicated industry that this community has an opportunity to capitalize on. So, a little bit about why I think and why I'm so passionate about the healthcare industry as it applies to economic development and how we can advance the law. Well, in 2012, we created the Mississippi Healthcare Industry Zone Act, and it was premised upon several zones throughout the state. And one of the main catalysts was the hospital that utilizes various services, and those services are based on patient care, but you need various things. You need Band-Aids to syringes to all sorts of equipment that's utilized to take care of the patient. But these zones were, in essence, created around large hospitals, 375 acute care beds. But we grew it so it would be able to encompass the entire state. The incentives. Well, business is built and driven upon economic opportunity incentives. And those incentives are lucrative. They consist of an ad valorem tax abatement, a sales tax exemption on equipment and construction materials, and an accelerated income tax depreciation deduction. So those are some of the things that we piled into the legislation that we thought would be very useful for businesses to attract those healthcare-related companies. And again, this new approach was built upon a new way of doing economic development. Never before have we gone after and incentivized clinics or medical device or pharmaceutical or research, R&D. All of this built around the auspices of healthcare. Well, there must be tweaks. With any piece of legislation, with any law that's created, we have to make it better. And I think one of the main ways we can make it better is that we can focus on planning and getting our communities to plan and focus and build a blueprint and reward those communities that put together comprehensive plans like the ones you see right there on the map. Another aspect of this law and another aspect that we have to focus on is the critical mass. The geniuses, the Christy Hendersons, the Dr. Summers. We have to get more people like that to either stay in Mississippi or recruit them here. And that has to be the economic model of not only recruiting companies and growing companies organically, but recruiting people and recruiting the brightest and the best and their NIH grants and getting people to stay in Mississippi to thwart the brain drain. But most importantly, I think it's the message. It's the transformational message, reducing the stigma and allowing and seeing that Mississippi and Jackson can be great and we can have this identity around healthcare as an economic driver. So the plan. Every idea, I think, starts with comprehensive planning, bringing everybody together, pulling people into a room and letting them understand and making them understand that we can do this, having an identity around this idea of planning and comprehensive strategy. Lake Nona, Florida is a perfect example. It's right outside of Orlando. It used to be a golf course, but through comprehensive planning, through the efforts of elected officials and private business and planning, that golf course is now a $3 billion healthcare cluster. Jennifer Feingold wrote an article in Fortune magazine in June 2014, and it's entitled, How to Build an American City. And in this article, she talked about that cluster, which is now, it represents over 5,000 jobs and $3 billion in investment. But it was all based on a plan. And a vibrant, cohesive healthcare corridor is what I think we can do here in Jackson. Maintaining sustainable growth and controlled growth. When you're exercising and executing that plan, I think you don't go beyond what your identity is. You have to know exactly what it is you can recruit and know exactly what it is your identity is. If it's diabetes, if it's thwarting diabetes, which we happen to have one of the most highest per capitas of diabetes in the country, if it's obesity, then so be it. Let that be your identity, to thwart those types of things, but at the same time, capitalize on them by producing the research that can change the world. So in doing that, we can build this same healthcare cluster with pharmaceutical, with distribution, research, clinics, hospitals, large Fortune 150 companies. We can do it all in the sense of this healthcare cluster that we can build in Jackson and create that identity. Jackson can be so many different things. But one of the things that I'm so passionate about, that I think Jackson can be and leverage its many assets with its many hospitals, with its many bright minds and its researchers, is by creating an identity around healthcare as an economic driver. Thank you.